When should you check oxygen saturation during a COPD flare-up? Imagine feeling your symptoms suddenly worsen and wondering what to do next. Knowing when to check your oxygen saturation can make a big difference in managing your flare-up. If you have chronic obstructive pulmonary disease or COPD, tracking your oxygen levels is a key part of your action plan. Your pulse oximeter, a small device that clips onto your finger, shows the percentage of oxygen in your blood. Normally, it reads above 95%, but during a flare-up, your target range is different. The moment you notice your symptoms getting worse is when you should check your oxygen saturation. Symptoms like increased shortness of breath, more coughing, thicker mucus, or a change in mucus color signal a flare-up. When these signs appear, use your pulse oximeter to check your oxygen level. This helps you and your healthcare team decide whether you need to adjust your treatment or seek medical help. During a flare-up, aim to keep your oxygen saturation between 88 and 92%. This range is safe for most people with COPD. If your oxygen level drops below 88%, it could mean your lungs are not getting enough oxygen. On the other hand, if your oxygen saturation goes above 92%, it might be harmful. Too much oxygen can slow your breathing and cause carbon dioxide to build up in your blood, making you feel worse. That is why oxygen therapy must be carefully monitored and adjusted. If you use supplemental oxygen at home, check your saturation before and after changing your oxygen flow. For example, if you increase your oxygen flow because you feel worse, check your level afterward to see if it improved. If your oxygen level falls below 88% despite using oxygen, or if you feel very unwell, seek medical help immediately. These are signs that your flare-up could be serious and needs prompt attention. In the hospital or during ambulance transport, healthcare providers will monitor your oxygen saturation closely. They will adjust your oxygen to keep it within the safe range. If you are using devices like BiPAP or high-flow nasal oxygen, your oxygen levels will be checked regularly to guide treatment. At home, use your pulse oximeter whenever you notice symptoms changing. Regular checks when you feel well can help you learn your usual oxygen levels. This makes it easier to recognize when something is wrong during a flare-up. If you do not have a pulse oximeter, pay close attention to your symptoms and follow your action plan. To sum up, check your oxygen saturation at the start of a flare-up, whenever your symptoms change, and after adjusting your oxygen therapy. Keep your oxygen levels between 88 and 92% during these times. If your levels go outside this range or you feel much worse, contact your healthcare provider immediately. This approach helps you stay safe and ensures you get the right care when you need it most.